Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department is preparing a COVID-19 transition plan into the new normal. More areas ease to alert level 1 as cases continue to drop nationwide. And a doctor is eyeing a Senate seat in a bid to bring her health advocacy to the upper chamber. Senatorial candidate Dr. Minguita Padilla joins us live. We're only 3 days into alert level 1 in Metro Manila and other areas, and the country records the lowest single-day increase so far this year. Wednesday's figures show 866 more people caught COVID, and this is the lowest since December 28th, when fresh cases were only at 400. It's been a year since the country rolled out COVID-19 vaccines. After overcoming supply issues, the government is now facing the challenge of finding the rest of the population who are still unvaccinated or have not availed of a booster shot. Carolyn Bonkin tells us more.
Most adults in this compound in Quezon City have been fully vaccinated against COVID-19. But some are not yet keen on getting a booster shot, like Gloria Gonzalez, a senior citizen. She finished her second dose of Sinovac last August, but is still contemplating about getting boosted.
Tatakot kasi ako ng anak ko. Ma, ba't ayaw mo pa magpabuksan? Baka mamaya maging zombie ka. Gago. Ayaw ko nga.
Jake Montales, meanwhile, considers getting an additional dose, but still hasn't got the time to visit a vaccination site.
Mas kailangan po siguro kasi para mas tumaas yung immune system.
1 year since the Philippines started its COVID-19 immunization, over 63 million people have been fully vaccinated, short of the 70 million target. Aside from convincing the vaccine hesitants, the government has been faced with a challenge of persuading people to get boosted. 36.7 million are eligible, but only 10 million availed of the additional dose.
Yung iba, nag-iisip kung kailangan ng booster. Yung iba naman na they don't see the urgency of the booster.
Many vaccines are still waiting to be used. Some have already expired. Others are nearing expiration.
We are still verifying and validating the numbers. Kasi yung iba, we have requested for extension of shelf life.
Infectious diseases specialists have been asking the public to get an additional dose after studies found protection against the Omicron variant declines after 3 to 6 months. A booster recharges the body's protection against COVID-19 infection. Cardiologist Gilbert Villela says this is especially true for those who have underlying illnesses like hypertension, diabetes, and heart disease. Their chance of being intubated or dying after catching the virus is higher. He says since not all of them are able to build immunity from the initial vaccination, a booster dose is necessary.
Overall, ang case fatality rate po ng COVID-19 ay 2.3%. Pero ito'y tumataas kapag may high blood ka from 2.3 to 6% pag meron ka ng hypertension.
Despite falling short of the target in the National Vaccination Day in February, there will be another massive vaccination drive from March 10 to 12. This time, vaccinators will turn to door-to-door outreach and will even visit workplaces like economic zones and government offices to have more health and economic frontliners covered. Caroline Bonkin, CNN Philippines.
A doctor is hoping to bring her health advocacy to the Senate. This ophthalmologist has been serving for 3 decades and also the president of the Eye Bank Foundation. She hopes to speed up the country's COVID-19 response, fix PhilHealth, and ensure free medicines under the Universal Health Care Program. Let's go straight to the source of the story, Senatorial candidate Dr. Minguita Padilla. Dr. Padilla, welcome to The Source. Maraming salamat po sa inyong oras.
Good morning, Pinky, sa mga nanood, and thank you also for inviting me to join you today.
I understand, Dr. Padilla, that you were against lockdowns, citywide lockdowns. In fact, you would be pushing for more granular lockdowns. But now that we are on alert level 1, I wanted to find out from you, is government actually on the right track in de-escalating Metro Manila and other areas under alert level 1?
Oh, definitely. The government is now on the right track in de-escalating our alert levels because it is time that we really open up the economy and really learn to live with the virus. Because our vaccination levels are now high. I'm also a vaccine advocate. I started becoming a vaccine advocate in 2017 when we convened the Doctors for Truth and Public Welfare, and now I'm also part of the Vaccine Advocacy Network. And the vaccination rate, ramp it up as many and as fast as possible. That has been the answer. That's the reason also our cases have gone down dramatically. That plus the Omicron virus, which affected so many people and rendered a lot of people with immunity, even those who haven't been vaccinated. So it was like a herd immunity combination because of vaccines, the high vaccine level, and also the Omicron. So now I agree. We should de-escalate already to alert level 1. They are doing the right thing. Because at this point, the deaths from malnutrition, from poverty, from loss of jobs, the harm that is being done because of that has far exceeded COVID-19 harm. So it's time to start coming out of the pandemic and entering into an endemic stage eventually. But this is the right thing.
And we're talking about vaccines. The numbers are 63 million vaccinated so far. What do you think of this figure? Are we doing well in terms of vaccination?
It depends which part of the Philippines you're talking about. Kung dito sa Metro Manila, NCR plus, yes, we're doing very well. I think the problem lies with the more difficult to reach areas, and that's the challenge here because the vaccines are there. They're there now, and we don't need anymore to go through this, different categories, etc. It should be open to all, qualified, all those who want to get it, those who need to get it, anywhere. And the problem is reaching the people who cannot be reached. Vaccine hesitancy has gone down. When we started the vaccination for COVID-19, it was as high as 65% were hesitant because of a lot of fake news and scare tactics and rumor mongering of the past since 2017. But now it's as low as 10 to even 5% in some areas. So we've done our job of advocating vaccination. The DOH has done a job of increasing the vaccination rate, but we need to reach out to the people yet who are unable or unwilling to go to the vaccination centers. So correct, tama, no? Tama yung plano na mag-door to door, mag-house to house, especially mga bedridden. Yun, kailangan mo yun. I agree with that as well. Right now, we're on the right track. Right now.
Okay, and tell us more about your thoughts on booster shots because there's been some sort of slowdown with people wanting to get booster shots. Dr. Padilla, ang tanong ho kasi nila ngayon, let's look at the numbers. We're at what? 866, the lowest since December 28. And people are wondering, kailangan pa ba talaga nilang magpa-booster? Because some would probably have some sort of concern on how that will actually affect their bodies.
Yes. I am not, okay. If you ask the experts on vaccinations, they'll tell you it's important to get the booster shot if you fall among the high risk. I mean, for me, that is where you should really have it, no? But for people, like what I mean by high risk, healthcare workers, we were all required to get one booster shot, okay? And then the elderly, those immunocompromised, those with comorbidities like hypertension, diabetes, gross obesity, those who are undergoing chemotherapy for cancer.
Mm-hmm.
But whether to have another booster shot.
We're losing Dr. Minguita Padilla on air. We will try to fix that. I was asking Dr. Padilla, how important really is it to get a booster shot? She was saying that definitely for those working in the front lines, the senior citizens and those with comorbidities, we lost her there and I think she's back. Dr. Padilla, go ahead.
Yeah. For those people, yes, it's important to get a booster shot. Now, there's a lot of opinion, even among doctors, about whether booster shots are necessary for the general population who are not immunocompromised. Am I still with you, or have you lost me again?
Yes, and what do you say to that, to the general population who are not seniors or have comorbidities?
I would say the most important thing is to get your complete shot. No, and I know some of my colleagues will not agree with me, but I think if you have had your COVID shots complete and you have a good immune system, then the necessity for a booster is not as important anymore, especially because of the advent of Omicron, where so many of us, and almost all of us, may have gotten it without even knowing it. No? So it would be nice and ideal to do an antibody testing or immune testing, but that's not feasible. Okay, so I would say, if you are an elderly person, if you're a healthcare worker, immunocompromised, or with any comorbidities, please do get your booster shots. That's the least. That's the least I will advocate. For those who are not in that category, if you're at the frontliner also, because sometimes they're economic frontliners who also have to deal with people whose presence is necessary in the workplace, I would also recommend a booster shot. Okay, but it's not as important as getting the full vaccine. The regular dose. You know why booster shots are important? You know what's happening in Hong Kong now? That's kind of scary.
Right.
It's a variant of Omicron. That's a variant of Omicron. And now this is where your booster shots come in. It's supposed to protect you against Omicron and its variants, no? More than just having the basic vaccination. So this is where the arguments are. Okay. Then again, we're actually kind of scared, not really scared, but a little baffled with what's happening to Hong Kong. This is where booster shots will come in. Now, if government has a lot of vaccinations, a lot of dosages, then we can push for booster shots, even among those who are not in the categories I stated. But
The general
if
population.
we are talking about those who should get it, those categories na lang muna. Because, you know, Pinky, I agree with Carl Chua of NEDA. We should, and with many other countries, we should stop dealing with the number of COVID cases. The number that we should be concerned about na lang is the number of severe and hospitalized cases. This is where we should be concerned. It's like saying we don't count the number of flu cases anymore. I mean, except you know, or else the common cold, except those that get severely ill.
Okay.
Then we report that. That's what we want to watch out for now. Healthy people, those who had full vaccines, those who have some immunity from Omicron, let's not make that our main concern for the boosters. Let's stick first with the high-risk people, because those are the ones likely to end up in hospitals.
Dr. Padilla, would you possibly change your mind if, because right now, there is no news of a new variant. The last of we heard is Omicron. Would you possibly change your mind in the event that a new variant surfaces?
There is a new variant, of Omicron, but
Which
it
one is
doesn't
this?
cause such
Yes.
problems. Yeah. Now,
It's-
if a new variant surfaces and we can see that it is that boosters do have a benefit, then I will push for boosters, even for those who don't fall under the category of the high risk, the ones I mentioned. Okay, then I would. But since we have the vaccines already, I want people not to be so worried about taking one booster. That's fine. I think they're worried about taking multiple boosters. I know some people have taken 5, 4. You know, that's when you might start to worry about what it can do with your immune system, because there's so much we don't know about this. No? But I wouldn't. People should not be afraid to get one booster. Okay, because it does help against Omicron. Although we are over the Omicron, surge. Just like maybe the people don't feel a need, no? And doctors aren't pushing that hard. Not pushing that hard. Okay, but once a variant of Omicron comes out, and we see, like, this is where surveillance is very important. If we see in the reporting, there's a community that it seems that there's a rise again in the cases, then we do granular lockdown, okay, of that community, and then we examine. We look at the variants there. If there's another variant, then I will really have to push for
That's That's when, of course, the Philippine Genome Center really plays a very, very important role. Dr. Padilla, we need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Senatorial candidate Dr. Minguita Padilla. I just wanted to get also your thoughts on the 100% capacity in workplaces and even public utility vehicles. Here's the part where definitely social distancing will not be observed dahil 100% na po yung capacity. Para ho ba sa inyo, is this a cause for concern? I ask that because number one, while the cases are going down, meron pa rin po tayong kababayan na takot na meron po silang katabi sa mga jeep o sa mga bus and not knowing kung positive yung katabi nila or not.
Okay, in areas like Metro Manila, where the vaccination rate is very high, and I really believe we have achieved herd immunity, I am not so worried. As long as you wear masks inside the public utility vehicles, you still follow the no talking, no eating inside the public utility vehicles kung saan 100% capacity. I think that basic precaution will be okay. Kasi nga, depende ka kasi kung saan kayo. No? In Manila, for example, I'm telling you, almost everybody has been vaccinated. And herd immunity is like that. You can never get everybody to be vaccinated. A certain percentage is enough. And the vaccinated and the immune will protect those who are not vaccinated. That's how you start living with the virus. Now, 100% capacity, I think it is only possible if they strictly adhere to the rules of mask wearing inside a public utility vehicle, no talking and no eating. That's it.
Okay.
Because that's how you do it, okay? And of course, no more barriers, because the barriers are actually the ones becomes repository for viruses, I believe in. So there's, as long as ventilation is good. Yes, another very important thing is keep the ventilation. Ventilation is very good in the public. Even if it's air conditioned, even if air conditioned, keep some windows open. That way ventilation. That's it.
All right. You know, your presidential, I think, and vice presidential candidate, and you yourself, I know that during an interview, one of your priorities would have to be something on the pandemic, to have a pandemic exit act, no? But let's talk about that now. Secretary Duque is already saying that we do have an endemic plan. The details of which we still are not aware of. At least I am not aware of that until now. Do you think that by now government should have been able to map out, tell us, implement what could be a pandemic exit plan? Yung pong pandemic to endemic plan?
Well, none of us have seen it either, no? But I'd like to think that it is there in the works, because even the one who seems to be really prepared is their economic planning secretary, the NEDA secretary, Kalchua, because he has a 10-point recovery plan, which is actually the endemic plan, no? Because like the flu pandemic of the 1918, 1919, 1920, it dies a natural death eventually. It's there. The virus will not go away totally, but it will live with us once we have a level where it's more medyo plateaued, either plateaued, just going around in a certain level, or going down without much hospitalizations anymore, where hospitalization is not overwhelming. Then we can tell ourselves we are entering now the endemic stage, where we can live with it, where it's present, but it does not cause havoc on our lives. Yan ang endemic stage. And I think we are entering that stage already. But I think the DOH is very cautious in saying that, because baka if they say that, people will get careless. I think it's more like that. So the plan should be both health and economic planning. The health planning, the economic planning is being talked about, already, the full capacity. But important, I think, Pinky, very important. One of the lessons we learned, we have to keep, is the work from home. We have to continue that. We learned one thing from the pandemic. We don't have to go. Many people don't have to go to offices every day. What's the advantage of this? We also cut down on our greenhouse gases. There's less pollution, less gastos, menos gastos na pamasahe, less traffic. And yet you can still be productive, and you can still be more productive. You can still be productive. Then maybe alternate working days, and then once a week you meet. This is still very effective, and it will also address the pollution problem and the greenhouse problems. I think the pandemic gave us lessons we should learn from. Let's not go back to the old ways that are wrong. No? Let's take care of. Let's continue practicing the good things we learned. That's part for me of the endemic transition. Now we have to keep the good things.
Plan,
Yes, we have to now we have to what do you call this, dramatically improve our internet capacity. Why? Many things we have to do virtually. It will also help us with our health agenda, because around the country we need to make sure they have internet capacity. We can empower the barangays. We can put nurse practitioners there when we have doctors. There's no excuse why we cannot have nurse practitioners and trained barangay health workers so that they can better man the units, the barangays, without overwhelming the health centers or the hospitals. They can just always do virtual. There's a lot of potential in virtual. We have to maximize that. That's part of the transition or the new normal. It has to be the new normal. And then the Universal Healthcare Act has to be fully implemented. Now we have the time. I beg your pardon.
Yeah, Dr. Padilla, we need to talk about that because I want to talk to you about PhilHealth and the Universal Healthcare Law, and also yung pong priority nyo, is it a pandemic exit plan or something to that effect, no? As a priority, should you make it to the Senate? So again, just a short break. We will be right back.
Okay, thank you.
You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Senatorial candidate Dr. Minguita Padilla. So your first, in case you make it to the Senate, what is the first bill that you will pass?
It's not to pass a bill. It's to practice my power of oversight over the Universal Healthcare Act and the PhilHealth Act. Because this is a major, a very, very important piece of legislation and a very important part of the healthcare of our people. No? PhilHealth is the agency that binds the whole country because it's the payer. It pays for the healthcare. But we know there's so many systemic problems inside PhilHealth. In fact, some lawmakers want it abolished and changed with a new agency as a means to get rid of the corrupt and keep the good, because there's so much. It has seeped through the old agency. No? If you listen to Harry Roque, he's very violently angry about it. No? But ako naman, we need to overhaul it and make sure that we fix the system so that there's also a policing of PhilHealth. Who polices PhilHealth? COA cannot police PhilHealth. Okay, and one of the major problems of PhilHealth is their information technology system. Our party keeps saying digitalization. Tama ang digitalization, but when you have a bad system, garbage in, garbage out, if you have a system that's porous and fragmented, may computer ka nga, pero yung iba't ibang agency within PhilHealth hindi nag-uusap ang ospital at PhilHealth, iba ang system. Therefore, you have money being lost in the system. They don't even have a tie-up with the Philippine Statistics Authority. That's why you have dead people still being paid for their dialysis, because there's corruption there. Because PhilHealth has no record of who died already. There should be real-time reporting to PhilHealth if somebody died, so that they don't keep paying services. Even DBM is paying for dead people. So much has to be changed. So an oversight of the UHC and PhilHealth Act. That's the first thing in order to fix the system.
Okay, I understand what you're saying with the oversight powers, which is part of the Senate to look into, let's say, what happened to PhilHealth. They did recommend charges against ex-PhilHealth officials and to the ombudsman.
And also amend the law, Pinky, because there's so much lacking in it. Things are happening because there's nothing in the law that mandates them to have twice a year, a random independent audit of their information technology system, because that's where a lot of the problems lie. And we have to have some deliverables as far as our ID is concerned. It's not there. They're too free to decide whether or not to do things correctly or not. There's not enough.
And who will do that?
The law
who will do the audit?
I want an independent, non-government, reputable IT company. Audit and random, not announced. I'll tell you something, Pinky. Sometime during 2017, when Secretary Onasan took over DICT, some of his people in their office tried to audit PhilHealth, the IT system of PhilHealth, because of these problems. And they were prevented from doing so by PhilHealth itself. So how can you do that? Why are they allowed to do that? They should not be allowed to say, no, you cannot audit our IT system, isn't it? I mean, that's where a lot of the problems are. So it has to be, if they should not have the right to say, no, nobody can audit our IT. They should be audited in the IT. And it is not money. Information technology system, that's where a lot of the anomalies are happening. Okay.
Do you think, Do you also support some of the recommendations of other senators that they want a professional, some sort of manager to be able to head PhilHealth, or do you think it must be a doctor who should head the agency?
Actually, Pinky, the Universal Healthcare Act specifies that the person who heads it the president of PhilHealth must have a health finance experience, 7 years, or public health. I don't think it should be public health. It should be health finance. Even that we should look into. Okay, a doctor need not. Some doctors have an experience in health finance. Those who have handled insurance companies, those who have handled companies that deal with health, for example, for many people. That has also health finance. It's there in the law, but it was not implemented properly. So the people put there, since the UHC was passed in 2019, have not exactly fulfilled the criteria for the president of PhilHealth. It is in the law. Again, that's oversight. And it's the president who has to follow that as well, isn't it? It wasn't highlighted that there were so many violations of the actual law. As far as the people were concerned, the members of the board of PhilHealth must be also held more accountable for what happens. Because what happens there, because I was there for 1.5 years. I was part of the EXECOM. I was co-terminus with the administration of Pinoy, the last 1.5 years. And I saw a lot of the problems and we tried to fix. We were able to effect some reforms. But the board of directors, they have to depend a lot on the EXECOM. But I think they should have more accountability as well for things that happen. And they must really, part of the UHC is that they must be trained. All the members of the board must undergo some training once appointed in health finance. Has this happened? I don't know. Because
Interesting.
if you have no training in health finance, it's in the law.
How would you understand
the Universal
it?
Healthcare Law has a lot. Yes, has many provisions, but were never implemented. Again, oversight is important. Why? Yeah.
Pinky,
one more thing. Yeah.
Go ahead, sige. One last.
One possible excuse is that it was signed in 2019 and we had the pandemic in 2020. That can be an excuse why it was not really fully implemented. Nakagulo, nabulabog tayo. We were not prepared. And that's another aspect. We need a Pandemic Preparedness Act. We need to be prepared. It can complement our disaster risk reduction agency, but we need the one really for coming pandemics, a playbook, so that we know really how to act now. Okay, I think we're going to be going out of the pandemic. Let's prepare. Let's make sure the UHC Act is implemented as it was envisioned to be, okay? Because it has not been implemented truly.
Okay. Very quickly, I have 10 seconds left. Do you think an overhaul of PhilHealth should be done, or scrap it all together and build a new one?
We can try to overhaul, but I'm afraid that it might be necessary to build a new one, as was the intention or the suggestion during the first draft of the UHC bill.
Okay.
If we have a good executive department, ombudsman, etc., to really make sure cases see the light of day and justice is rendered and people held accountable, then maybe we can just overhaul. Otherwise, we may have to change it altogether.
Senatorial candidate Minguita Padilla, ma'am, thank you so much for your time and good luck to you.
You're welcome, and thank you also, Pinky. Good morning, everyone.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.